Gout can cause sudden and severe episodes of joint pain due to the buildup of crystals in the joint. It can affect men of any age, but is less common in women, and usually only occurs after the menopause. Once treated, it is not a problem for most people, and gout is probably the one type of arthritis for which there is the most satisfactory treatment. Gout is caused by high levels of uric acid, also known as urate, collecting in your body, and then forming crystals in some of your joints. This occurs when susceptible people eat certain foods, for instance meat, fish and beer, which contain a lot of chemicals called purines. Organ meat, such as liver and kidneys, and fish, such as anchovies and herring, are particularly high in purines. When the body breaks down purines, it produces uric acid. We all have some uric acid in our body, but most of us pass out enough in our urine to keep the amount at a low level in our blood. Some people, however, don't pass out enough uric acid in their urine, or they may produce more than is normal in the first place, so that the level of uric acid in their blood and tissue fluids is higher than it should be. When there is too much uric acid in the tissues, it can form crystals. These sharp needle-like urate crystals can form in and around joints. If they enter into joint space, they cause inflammation, swelling, and severe pain. A tendency to develop gout is influenced by genetics and family history. In saying this, just because it is in your family does not mean that it will be passed on to you. If you maintain a healthy diet and lifestyle, it can potentially be avoided. Gout commonly attacks the joints at the base of the big toe, but it may affect other joints. Signs and symptoms of gout are generally acute, meaning that they come on suddenly and usually without warning. A significant proportion of people with gout tend to experience symptoms at night. The joint starts to ache, then quickly becomes swollen, red, and extremely painful. The attack usually lasts for a few days, then dies down, and the joint gradually returns to normal. 1. Attacks usually occur in the big toe, and any physical contact is painful. The joint becomes swollen and hot, and can often look like an infection. 2. Gout may also occur in the ankles, hands, wrists, knees, or feet. If several joints are inflamed at once, it is called polyarticular gout. 3. The urate crystals which cause gout in your joints may also collect under the skin, forming small, firm white pimples called tophi, which are not usually painful. Without treatment, an initial acute attack of gout will run its course within several days or a week, by which time all outward evidence of the disease disappears. However, approximately 50% or more of people with gout have a second attack, which may not occur for months or years. Subsequent attacks, however, are likely to be more frequent, more severe, and more destructive to joints and other tissue unless the problem is treated. The role that you can play in managing your arthritis is discussed in more detail in Module 2, and medications you might be prescribed are discussed in Module 3.